sunshine. It's our sunshine.
I'm Dr. Ajit Vikram, consultant urologist and andrologist of Sunshine Hospital, Secunderabad. This month of September is followed all over the world as a carcinoma prostate month. Any patient has a doubt about what is prostate cancer, they can all follow this to know about what is carcinoma prostate and what should be done. Prostate gland itself is it's a small walnut-sized gland of the male reproductive system. Location-wise, it is located at the base of the bladder, surrounding the base of the urethra, and with rectum behind it. So this prostate gland has specific functions in the male reproductive system, like it contributes the seminal fluid, which is very important for the transport, nourishment of the semen. So prostate per se gland is one of the major important gland in the male reproductive system. Prostate cancer is different from other cancers in n number of ways, and like say what causes prostate cancer, and the basic question, it differs from other cancers like what causes lung cancer, what causes blood cancer, and what causes liver cancer. They have a clear-cut etiology or not. To prostate cancer doesn't have a clear etiology, and etiology is still not so well understood, but proven fact or etiology of carcinoma prostate, like it has a strong genetic predisposition, one cause, and a strong familial cause for carcinoma prostate. Like strong, when I said familial, say at what age your preceders have got CA prostate, at a young age or not, or direct first degree relatives or second degree relatives. All these points take into consideration when there is a strong familial predisposition for carcinoma prostate. Prostate cancer is a very difficult or less percentage of patients we see under 50 years of age. Most commonly we see at the around age of 65 to 65 plus. Median age of when we diagnose carcinoma prostate is 65 to 68 years. Patient classical cancer prostate classical symptoms you will not find it. That is one of the reasons why we cannot diagnose it at an earlier stage unless we screen the patients. Suppose the patient has particular urinary symptoms, like urinary, what we find in normal benign prostatic hyperplasia condition, whatever urinary symptoms. Apart from that, if there is blood in the urine, or if there is classical symptoms like straining to void, or any voiding symptoms or obstructive symptoms, or if the disease has already spread advanced stage, the patient might have bone pains, other constitutional symptoms then that can come into as a symptomatology of carcinoma prostate. But classically, patients will not present with this and this symptoms of which can diagnose it based on the symptoms. So that is how the carcinoma prostate differs from rest of the cancers. Definitely can be prevented. That is why we are educating common population to come for screening. Any patient or any person, irrespective of the symptoms, a male person above 50 years is always advised to come and meet a urologist, get himself screened. Like when there is a topic about how it can be prevented, it can be prevented only by early screening of the disease. Like there are certain blood tests like prostate specific antigen. We do an ultrasound scan to find out the levels of prostate specific antigen in the blood, gives us a clue about whether this patient falls into the risk group of he might get into carcinoma prostate. And ultrasound scan will measure the size of the gland, and we correlate size of the gland with prostate specific antigen value in the blood. We do a digital rectal examination wherein we try to palpate for the prostate, which can definitely give us a rough idea about whether this prostate is normal or hard, or he has a tendency of he falls into low risk or high risk group of patient for carcinoma prostate. And from here we take up to further evaluation of the patient. Suppose that the PSA value is high, ask the patient to get a biopsy of the prostate done, wherein biopsy of the prostate will definitely tell us what exactly the tissue of the prostate, whether it is benign, it is a malignancy, and if it is malignancy, we'll know how high grade it is and what should the treatment pattern be. And based on that, we further proceed. Coming to the treatment part of carcinoma prostate, once we have diagnosed that this patient is a carcinoma prostate patient, based on like previously said, prostate biopsy report or further CT scans, and we try to localize the disease, where the disease is. Is the disease confined to the prostate, or the disease has already spread apart from the prostate, invading the adjacent structures or invading the bones, which is the most common predilection for carcinoma prostate. Based on that, we try to treat the patient. Suppose if the cancer of the prostate is located or it is confined only to the gland and has not invaded any structures, we try to do a complete radical prostatectomy where we completely remove the prostate, and you can take it for granted that the cancer is also removed. That is only done if the prostate cancer is confined only to the gland. Suppose it has already breached the prostate and it has spread to other organs, and we call it as metastatic prostate cancer, and it has spread to bones. We go for another modality of treatment wherein we do a bilateral orchidectomy, wherein we remove the source of the testosterone, which is the source for carcinoma prostate growth. We remove the testis of the patient bilaterally, and we put him on anti-androgens, because androgens form the basic ground for the growth of the carcinoma prostate. So we try to knock off by giving anti-androgens after removing both the testes. Thereby we are treating, even the patient has advanced prostate cancer also, we can treat the patient if they have come to us at an early stage. My advice to the common public would be all men above 50 years, irrespective of whether or not you have any urinary symptoms or you have any symptoms per se which is troubling you, it is always better to consult a urologist. Get yourself a routine screening for carcinoma prostate, which will help us to find out the cases at a very early stage, and which gives us the advantage to completely treat the patient, eradicate the cancer, and give him a long span. This is one cancer wherein there is nothing to fear about. Even if a patient is diagnosed at a advanced stage or so, the rate of growth of the cancer prostate is not like other cancers, wherein we have advanced medication to treat the prostate cancer even if it is in an advanced stage. But said and done, it is always better to screen the patients once the male population age crosses the 50, so that we can give an efficient treatment at a particular stage of the treatment.
Sunshine, it's our sunshine.